Hi, my name is Alyssa Godfrey, and today I'm going to be presenting on diabetes. Diabetes is an endocrine disorder that can further be broken down into type 1 and type 2 diabetes. Both diseases are characterized by high glucose levels in the blood, so that can either result from a defect in insulin secretion or the action of insulin, or both. So more specifically, type 1 diabetics, that's generally an abrupt onset, usually in childhood, and it's essentially just caused by the destruction of beta islet cells in the pancreas. So there's a complete deficiency of insulin secretion. The pancreas cannot produce insulin. Type 2 diabetes is, again, generally has a later onset in adulthood. It can be caused by either a deficiency of insulin production or a resistance to the action of insulin by the cells of the body. People with diabetes can be hyperglycemic or hypoglycemic. So for a normal person who doesn't have diabetes, the way it should work is we should eat. The glucose in our blood causes the pancreas to release insulin. Insulin should bind to our cells, and then in doing so, glucose receptors go to the surface of the cell and they bring glucose from the blood into the cells for metabolism. Someone who's diabetic, this doesn't work. So they can be hyperglycemic, which means that there is too much glucose in the blood, or they can be hypoglycemic, which means that there's not enough glucose in the blood. So both of these can cause really serious issues. Diabetes that is not addressed or treated ultimately can cause a lot of very serious issues or death. So there are several tests that can be used to address whether or not someone's diabetic. There's something called a fasting blood glucose, an FBG. That's used to measure glucose levels in the blood after the patient has fasted for at least 8 hours. It's very common to diagnose diabetes. There's another test called the glucose tolerance test. It's generally more accurate, but what it is that patients fast for, again, 8 or 12 hours, and then they will ingest glucose, and blood will be taken, and then the clinician will determine how quickly glucose can be cleared from the blood. So again, another diagnostic method for diabetes. People with type 1 diabetes generally have to use insulin injections because their bodies can't create or produce insulin. So if they don't, then blood sugar levels will rise to a dangerous level because there's no insulin to signal that the cells need to take the glucose in. So insulins are just injectables that are used to replace insulin in patients. Again, mostly with type 1 diabetes, but sometimes with type 2. They can sometimes wear a continuous glucose monitor or an insulin pump, and that is just basically a way of automatically regulating their blood sugar, making sure that they're not going too high or too low. People with type 2 diabetes, you can increase insulin receptor sensitivity sometimes by diet and exercise, but a lot of people with type 2 diabetes take oral anti-diabetics. So like a very common one is metformin. It's generally used to treat type 2, and it stimulates the pancreas to either produce more insulin or to make the receptors on the cell, the insulin receptors, more sensitive. So that's just a very general overview of diabetes. It's a really complicated disease. People have many different ways of managing it. Those are just the general facts.